international speaker and health expert, Dr. Sarah Farrant, with us. We're going to be talking about health. To be more particular, children's health. Doctor, welcome. Thanks for talking to us. You are the founder of vitalmoms.com, which says what to us?
It's about creating the opportunity for smart health choices for your family. So it's teaching parents, mothers that are really despondent and frustrated with the current state of their child's health, that they can go somewhere to find the different options.
Now, why would we be despondent and discouraged about our children's health overall? Your focus on that.
Yeah. It's when we have like little Johnny or Sally that's at home that's constantly getting the cold and constantly getting the runny nose, and the mum is just at home just going, why? Why is this constantly happening to my child? There must be another way.
And they don't want to take them to the physician. They want to do it take care of the child at home, in the home.
Well, I think what they have been doing is that they have been going down that allopathic route, that allopathic route.
You call it 3 A's.
Yeah, 3 A's. Yeah. And what we're finding is that, or what I'm seeing is that the mums that are going down that route, they're the ones that are getting frustrated, but they don't know what other options are available to them.
What are the 3 A's?
The 3 A's, the first one is the allopathic model, which is traditionally called the medicine model or the mechanistic model.
AMA.
Yeah, yeah, exactly. And then the next one is the alternative model, and that one is everything. It has a catch cry, which is usually called complementary and alternative medicine. Anything that's not medicine or dispensing drugs of any kind would be under this alternative model. And the next one that I've kind of worked out is called an alternate model. So each one, when you look at the Latin derivatives of the name, which I found really interesting, allopathic, pathic means remaining passive. So in this particular model, what we find is people will go to someone to get something.
A doctor.
Yes, to take something away. So it's a fix-it model. It's usually based on fear and what-if questions. Well, what if I don't take this? What's going to happen to me? You know, what if I don't do that? What's going to happen to me? Now, the alternative model, native, when you look at the Latin derivative of native, actually means offering a choice. So here we have this alternative model, which is I'll still do kind of the same philosophy. I'll still go to someone to get something, to take something away, but now I'm doing it in a model where I've got some choice. So I can have herbs, or I can have tinctures, or I can look at a different profession that might be able to assist me.
Okay, so now you have two.
That's two, yes. So then the third model, the alternate, nate as a Latin derivative means inborn. So this is where we start to see people awakening themselves to realizing, you know, I have everything inside of me in order to express health, that I've created whatever it is that I've created in order to have this opportunity to grow. So this model sits with the understanding that the nerve system is the master system of your body, and that if there's miscommunication in that, then that miscommunication is going to set up a sign and symptom to help us ask the questions to wake us up.
Those last two, taking responsibility, personal responsibility, isn't that basically what you're saying with those?
Yeah, absolutely. Especially in this alternate model, it's really built on trust. How do we get ourselves back to that point of trust? And there was a time when I was little, I was actually 7, and my dad, you know, he passed away a year ago, but he, in such a heartfelt way, at the age of 7, he tapped over my heart and he said to me, he said, Sarah, you have all the answers inside of you. All you have to do is ask the question and trust the answer.
We've heard for many years, decades, centuries.
Centuries.
Centuries. Let's go to centuries.
Socrates and Plato.
That the body will heal itself given the nutrition, given the tools with which to do this.
Yeah.
So the body can and will heal itself.
Yeah, it can and it does. And, you know, everything from the cut finger all the way through. And my dad gave me that opportunity to ask the questions, and I feel that that's where the mums are.
What do you mean by asking the questions? Help us here.
So it would be like, why have I created this? What's this happen? What's the good that's coming out of this, and what's the bad that's coming out of this? There's always, Dad always said, like, you might teach your own, you know, kids. I know, Lou, you've got kids, but the questions is, well, what's the good out of that, and what's the bad out of that? You know, I always remember Dad saying, what are the pros and what are the cons? You know, out of the, and so I've just taken his model and put that into health. Well, what are the benefits and what are the drawbacks?
Doctor, what are your thoughts on pharmaceuticals? We talked about that as option number one, going to the doctor. Here's your pills to take.
Yeah.
Do you think the pharmaceuticals are a crutch for us in today's world?
Or is there a time and place for them?
I think there's a time and place for them. I do. I think because these three models are so separate and so distinctly different, that they each have their place. That's why they all exist.
Okay.
Right.
It's just finding the place to where you might be better of service to people.
But it's so easy to go to the pills, or to go
It
to...
is, and we have that quick fix model. I mean, now you can get the microwave dinner in 3 minutes. Bang, pop it in, and you've got your dinner. You know,
And so people don't want to think about taking responsibility when I can just take a pill.
Yeah, I'm not sure if they don't want to take responsibility. I think we're just so indoctrinated into that way of thinking.
Nor know how, maybe.
Yeah.
Nor have the knowledge or been educated as to how.
Absolutely.
As a health professional, people who come to you, are they open to the 3 A's?
They're kind of on that exit way from the allopathic model, and they're looking to do their health differently. They've started to ask those questions. There must be another way. They're frustrated, despondent, my child's always sick, or I'm always sick, whichever model they
Well,
have.
and I think you're also speaking about preventative, because I know with children, colds, there are ways to prevent a cold with a child or with an adult, correct?
Yeah. Well, here's an example that we have with our kids, because I always look at the I teach our kids that there's an opportunity, and when I first became pregnant with our oldest son, I said, you know, I don't want to give them the language of this allopathic model. I want to create the language that we have for this alternate model. So I came up with the term health expression. So rather than saying to our kids, you're sick, I'm just saying you're just having an expression of health. That can be good and that can be bad, you know. Let's celebrate that you've got a milestone here and you're giving yourself an opportunity to grow. So at the age of 5.5, before we moved from Australia to New Zealand, I was laying in bed with my husband. I could hear my son in the front room, and I just said to Randall, you know what, I'm just going to go and check on Annam. So I went up to his bedroom. He was lying in bed and he was rolling around and moaning, and I knelt down beside him and I put my hand gently on his forearm and I said, so what's going on? And he said, I don't know. I said, Annam, you do know what's going on. And he stopped and he said, well, clearly I'm having a health expression. And I was like, great. So what's the health expression about? You know, physical, chemical, or emotional? And again, he was like, I don't know. And I said, you do know physical, chemical, emotional. And he stopped and he said, it's physical. I'm like, great. Okay, so we've got a health expression. It's about the physical. What's the physical about? Again, just asking them questions to get to that center place of trust. And he said, he stopped and he said, well, you know the skate park that you take me to? And I said, yes. Because we home educate our kids in this model of life, and he stands on the top of this hill and he finds it hard to get down the hill. You know, he's just challenged with doing it. He said, I think that I'm going to grow in my strength and get down that hill. And I stopped him and I said, do you think or do you know? And he went, I know.
Hold your thoughts, we're coming back.
Dr. Sarah Farrant with us. Doctor, this is very interesting, obviously, to our audience and certainly to Tanya and myself sitting here at the table. Is this mind over matter that we're talking about here in some way, shape, or form?
I feel it's about indoctrination and how we're brought up, so how it starts from such a young age that our mind is just shaped in that way, and it takes sometimes it takes someone like me asking someone different questions to help wake them up to see, well, what's actually happening in your life.
Can our mind repair our body?
Yes, and can our body repair our mind? Yes, it's a circuit.
Okay.
Yeah.
And you know, not to bash the AMA, there's a place and time for all of that, obviously, for everyone. There is a time when you do have to go to medication, you do have to take the AMA approach. But I believe we should take it more seriously, because when you have a commercial on television that is a 30-second commercial and 27 seconds of it is telling you the precautions, the side effects of this pill, you might want to rethink looking at that lightly.
Yeah, that's got to wake you up in some way, doesn't it?
And And maybe, yes, you do need the pill. And I'm not trying to say to anybody taking pills, I mean,
to not take
them. But you probably should maybe take it a bit more seriously than sometimes I think we do.
Yeah, and it's really interesting because that you say that, because we had a nanny in our life for 2 years, and I thought that, I mean, I speak around the world, I thought that I had educated her well on our belief system. But last year, in the middle of the year, she actually came into our house and said that your children are really sick and you're not doing anything about it, and you need to, I'm going to go ahead and I'm going to call.
What was she basing the fact on that your children were sick?
She thought that they had fevers.
Did they?
No. That's the
you're
thing.
A health professional.
Exactly.
You know fever. I think you know fever.
Yeah, absolutely.
Okay.
So, and they didn't. And she, and when I said, look, they don't, and she just said, I have no choice but to call child services on you. Now, when someone calls child services on you, all of a sudden you have no rights to your kids. So for 3 months, we're fighting the rights for our children. Now, in order for us to get off this list of parents that were denying the right for their children for medical treatment, and our kids have never been in that system. They're not indoctrinated in that thought. So we had to go to a medical doctor, and I said, well, if we're going to find someone, let's get someone on the island. I want to go straight away, because if they're going to take the temperature, I'm going to realize that I'm absolutely right that they don't have temperatures.
Well, did they run blood tests? Are your children healthy?
No. Yes. Yes.
That's exactly the question.
It was what they did was they took the temperatures. The kids' temperatures were all normal, and this is how the whole Vital Mums thing arose for me. It's like, I want to be able to teach mums that there are other ways. Your employee? No, that day she left that day.
So she's probably...
She walked out the door and did not come back.
So she's probably sick that she doesn't have a job right now.
Probably. I did see her car for sale.
But how old are your children?
They're 8, 6, and 4.
And they're all indoctrinated into your philosophy,
our way of thinking,
and they're very healthy. Very
healthy. They've been adjusted. In fact, people just say how well adjusted, interestingly, our kids are.
So we're really walking into the avenue also. Lou brought it up earlier, and this is not the cure-all be-all for everything, don't misunderstand me, but we're walking into the avenue of the mind having control of our health also.
Yeah. What we think about, we bring about. You know,
we create.
Yeah, absolutely.
And there's been many cases like this. Obviously, we know the ones where people have extreme cancer, and people say there's no cure, and suddenly they're cured. I mean, there is some validity.
Well, and the word incurable just means curable from within. You know, we can look at it in 2 ways. It depends on how you look at it. You know?
Doctor, you are in Phoenix. You're touring with the book. You're speaking.
I'm speaking. I'm going to a conference in Scottsdale.
Okay.
And then I've done some radio shows, and it was just a great fit to be here with you guys.
Excellent. Thank you. Where can we find the book?
Thank you. The book you can get from drsarahfarrant.com. And if there are mums out there that are in that frustrated and despondent, then they can email me or go to the website vitalmums.com.
Assessing the possibilities of unlimited health. Doctor, you are a delight. Thank you so much for being here.
Thank you.
Thank you, Doctor.